Hello everyone, I am Dr. Vandana Jain. Today I am going to demonstrate dermoid cyst enucleation. So this is a young married female who presented to us with a dermoid cyst. She was infertile, she was not able to have a baby for almost 3 years. So as you can see, during a laparoscopy we did an evaluation first of the tubes and ovaries. She presented to us with a case of dermoid. It was a dermoid on the right side. The MRI confirmed the diagnosis of it being a benign tumor and all the tumor markers were in the range. Here we are going to demonstrate the cyst enucleation. We mark the incision with the help of bipolar forceps on the surface. Then this is the step which requires maximum precision. If you spend an extra 2 minutes here, you will save a lot of time later and also you will promise a good future to the patient. So make a sharp nick but try to remain superficial. Try to find the plane between the dermoid cyst and the ovarian surface. In cases of very large cyst or very old standing cyst, sometimes the plane is difficult to find because the cortex lining over the cyst is very thin. You have to hold maximum patience at this point. Your assistant holds the ovarian cortex from the other side and you from the one side. Try to apply the principles of traction and counter-traction here also and apply force on the cortex, not on the cyst. As you find the plane, insinuate your scissors in between the cyst and the cortex and try to remove the cortex from the cyst. Wherever you find any oozing or bleeding, use bipolar forceps. As you can see here, we found the right plane between the cyst and the cortex. Now again we are increasing the incision with the help of forceps so that the bleeding is minimal. The principle remains the same. The scissors, the nick, everything should be very superficial and find the right plane. If you are in the right plane, the bleeding as it is will be minimal. Wherever required, use sharp nicks, otherwise you can insinuate your grasper and find the correct plane. Only thing to remember is do not apply any unnecessary force or traction on the cyst, rather put the force on the cortex. As you can see here, the cyst lining is thin. We now insert a bag to prevent any spillage, and if accidentally occurs any, it would occur in the bag. This is our homemade bags. We use these sterilized plastic covers and sew them with a silk thread. Now we do the further enucleation in our bag. Keep on increasing the incision and enucleating the cyst. As you can see here again, gentle strokes with the help of grasper separate the cyst from the ovarian cortex. Now at the very end, you might need to use a bipolar or a monopolar cutting to prevent any further bleeding. The cyst is put in the bag. We inspect the ovary, see for any bleeding, cauterize that, and here we can see the cyst is enucleated in toto in the bag.